Dumont.
WABD Dumont in New York.
The Johns Hopkins Science Review, presented by the Johns Hopkins University and WAAM in Baltimore. This is the Johns Hopkins University, famed for 75 years for its contributions to science and the humanities. Here in its many laboratories, Hopkins scientists are constantly probing into the still unknown secrets of science, which, when discovered, will be translated into benefits to be enjoyed by you, the people of America. Each week, we look over the shoulders of today's scientists and catch a glimpse of the results of their research. This week, we see the work of the artist and the doctor. And here is Lynn Poole of the Johns Hopkins University to introduce this week's program.
Greetings, ladies and gentlemen, and welcome to another Johns Hopkins Science Review. Now, our story for this week begins in Vienna in the latter part of the 19th century. Now, in 1885, Vienna was a very gay city. It was also the cultural capital of the world. At the same time, it was one of the scientific capitals of the world. Men like Mahl, Spaltzeholz, and Ludwig were in their anatomical institute in Vienna probing deeper and deeper, trying to find the cures for the ills of the humankind. At the same time, these men were training young doctors, young scientists to carry on their work. Well, now, one night in 1885, in the old Victorian study of Dr. Carl Ludwig was talking with a young medical student named Max Bradel and was giving him some very good advice.
No, Max Bradel. You must not give up your study in drawing. Your gift is too great.
But, Herr Doctor, I shall never be a great artist. But here in your anatomical laboratories, I have learned much about medical science. Perhaps I become a great doctor like you.
No. Yeah, that is just the point, my dear sir. You have been trained in the science of anatomy and in the careful, accurate drawings of the parts of the body. Bradel, I predict that you will be vital in the development of medicine and surgery. Let me give you a reason. I will give you an example. You remember the amazing operation performed in London by Dr. Spencer? Well, doctors around the world are waiting to see how it was performed. They are waiting to know how this new technique was developed. But how can we see it? Only by traveling long, weary miles to London by coach and channel boat can we see the delicate methods he used.
It takes a long time to get to London, and much money.
Of course it does, and we cannot spare the time.
But Dr. Spencer will surely publish his operation in the medical journal.
Most certainly. But how can we see what he does? The techniques will be illustrated in the journal, but these illustrations will be done by some dummkopf of a penman who knows nothing about anatomy and even less about art.
Then you believe artists should be meticulous draftsmen, familiar with medical science.
Exactly. Someday that will be done. It must be done. These medical artists will work side by side with the doctors in the operating room, in the clinic, in the research laboratory. These artists will make drawings of the progress of a patient's disease so that the doctors can see and compare this progress. So they even use these records in scientific research. All of these and many others in the realms of art will someday be joined together and applied to medicine. Artists and doctors will work together. Think seriously of this, Max Bradel. You're the first to be trained in art and medicine. Who knows? You might, in time, become the leader in a great new field.
And Dr. Carl Ludwig's prophecy came true. Young Max Bradel was inspired with this challenge that Dr. Ludwig gave him. He studied hard in his medicine, he studied hard in his art. And he came to America and came to Johns Hopkins and established the first medical school as applied to art. And here is the subject that we want to tell you tonight. These medical artists, these medical illustrators are working side by side with the doctor just as Carl Ludwig said they would do. They work in the laboratory, in the clinical research, and in the operating room. We would like to show you how they work and what they do.
The human eye is one of the most delicate mechanisms in our bodies. The muscles in our eyes are so skillfully engineered, so delicately balanced, that both eyes work in a beautifully synchronized motion. The eye muscles act together so that both eyes can turn to the left, to the right, look up, and look down. But what mechanism is there in the eye which acts to allow us to see? To explain this, we find our first example of the work of the medical illustrator. Trained as artist and anatomist, a medical illustrator was able to prepare this diagrammatic section of an eye. This is a horizontal section of the eye. Let's look at it part by part. This is the cornea, which is transparent like a watch crystal. Here is the iris. The opening between the two sections of the iris is the pupil of the eye. Behind the iris is the lens. The retina lines the inner portion of the eyeball between these points. The retina corresponds to film in a camera. Light is reflected from an object, here penetrates the cornea, passes through the pupil, through the lens, on through a gelatin-like substance, and falls on the retina. Here the visual image is transmitted by the nerve fibers in the retina through the optic nerve to the brain. In spite of the power of the human eye, it does fail us sometimes. Things will happen to the eye. In this case, your doctor sends you to an ophthalmologist for examination. The eye doctor may wish to have a visual record of the affected eye, and he'll call in his medical illustrator. The medical illustrator will examine your eye with an apparatus like this. This is called a slit lamp, a lamp and optical system which allows the medical illustrator to study your iris and cornea. You would sit down on the far side of the slit lamp apparatus and drop your chin on a chin rest in order to hold your head firm and steady so that the illustrator can sketch what she sees in your iris or cornea. Mrs. Annette Burgess, medical illustrator for the Wilmer Eye Institute of the Johns Hopkins Hospital, is focusing her magnifying lenses on the cornea of the patient's eye. And this is what she sees. Here we see the cornea and iris of the eye. This area here is the normal cornea, like a watch crystal. It is perfectly transparent. Underlying the transparent cornea, the normal iris tissue is seen. Now notice this region. The cornea is hazy. Notice the small white portions. Mrs. Burgess will tell us about these in a moment. Moving her microscopic lens back and forth across the iris of the patient's eye, Mrs. Burgess is able to see even the tiniest particle of the eye. She is able to see any abnormality which may exist in the eye. As she recognizes the damaged portions of the eye, she makes quick sketches to record the damage. Let's watch as she works. Working for hours with fine and sure strokes of pencil, pen, and brush, Mrs. Burgess finally finishes the drawing, which is now ready for use by the doctor. We cannot listen as the doctor discusses this drawing, but we can ask Mrs. Burgess to tell us about it.
The upper area of the cornea is clear and transparent, and the iris is normal. In this lower region, the cornea has become very hazy and has the appearance of ground glass. There are opacities, these white spots, and also growing on the anterior surface of these small, twisted little bits of tissue that look like Christmas balls. They're movable with the eye, and they're very painful.
Mrs. Burgess has in her hand another object used by artist and doctor. You have all seen it. It is an ophthalmoscope with which a doctor examines the retina of the eye. The medical artist employs the same instrument as she looks at the retina of an eye in preparation for making a drawing of that retina.
You look up, please. Look down. To your right. To your left. Now straight into the light. I would like to show you this. The optic nerve is hazy, not clearly defined as it is in the normal. The retina has become detached in this entire area. There's fluid beneath it that gives it this wavy appearance, and the blood vessels follow along, indicate the waves. The veins are large and engorged, quite tortuous. The arteries are also tortuous. There's a bit of pressure where they cross the veins. This area, the macula, is still fairly normal, so the patient has some vision.
This drawing of the retina of an eye prepared by Mrs. Burgess is used in teaching students to illustrate a rare eye condition, an inflammatory detachment of the retina. Here is another drawing of the retina of a patient in a very advanced stage of diabetes. These spots show small hemorrhage. Here are changes in size and dissection of blood vessels. This painting is one of a series which records each stage in the development of the disease and is therefore important to medical knowledge. At the moment, Mr. Leon Schlossberg, a member of the Hopkins Medical Arts staff and well known in his profession, is sketching a heart which demonstrates a peculiar malformation known popularly as the blue baby heart, for which a special corrective operation was developed at the Johns Hopkins Hospital. Let's look closer at Mr. Schlossberg's work. Mr. Schlossberg has prepared drawings of all parts of the body for use in medical journals, commercial journals, textbooks, and medical files kept for research. At the moment, he is preparing a pen and ink drawing to be used in a medical journal. The medical artist works in the stillness, in the quiet of the studio, just like any other artist. Mr. Schlossberg's drawing of the heart is now ready to be sent to the printer, and the drawing appears here in a surgical journal to illustrate an article written by Dr. Alfred Blaylock of Johns Hopkins. This article will be read by hundreds of doctors. Here is another example of the many uses for the work done by this new profession of highly skilled medical artists. Now that we have seen how Mr. Schlossberg works, let's ask him to show us another drawing he has made and tell us how this drawing was used.
One of the recent drawings made was this illustration of the fetal circulation. It is a transparency type of illustration which demonstrates the course of the blood flow through the unborn baby. This illustration was made for a pharmaceutical company, Winthrop Stearns. Since the placenta is the source of nourishment for the baby, it will be a good place to begin tracing the flow of blood. The blood flows via the umbilical cord and enters the baby through the navel. And the blood travels through the liver on its way to the heart, this being the heart. The blood enters the right auricle and passes through a shunt, the foramen ovale, to the left side of the heart and out of the heart to the rest of the body. And in addition to this shunt, there is another, the ductus arteriosus. Both of these shunts close shortly after birth when the lungs begin to function. The blood is returned from the baby via the umbilical cord and passes to the placenta.
It is safe to say that practically every bone, nerve, muscle, tissue, and organ in the human body has been sketched by a medical artist as an aid to the advancement of medical science. This drawing, for example, is particularly apropos at the moment when winter winds are sweeping across the country. Here we see a cross-section of a head, reproducing in great detail the nasal passages and the sinuses. The human brain has often been called the guidepost of humanity. Centered here are man's directives, both physical and moral. As the science of brain surgery develops to a higher degree, we must have drawings such as this. Another vital organ of the body is the lung. Here is a drawing of both lungs surrounded by other organs of the body as they actually lie within the body. This drawing was prepared to demonstrate the condition of the lungs when they become asthmatic. Mr. Schlossberg's drawing illustrates bronchial asthma. In detail, this drawing means little to we laymen, but to the medical research scientist, it is full of meaning and tells him much about the asthmatic condition. Such drawings play their part in medical research, so eventually are important to each of us. Here we see something quite different. It is a photograph of the inside of a human brain. And with this, we enter another realm of the profession of medical art. This photograph was taken by a man who eventually turned to the camera as the medium and instrument through which he could best serve the profession of art as applied to medicine, through which he could make a contribution to the growth of medical science. This man is Mr. Chester Reether, a member of the Hopkins medical art staff, who works side by side with clinical, practicing, and research doctors, preparing photographs of many types. Mr. Reether and others on the staff work with camera instead of pencil and paint. In this photograph taken by a staff member at Johns Hopkins, we see the picture of a lady who was born with the lower portion of her face missing. The lady graciously gave us permission to use this photograph so that we could show you this area of medical illustration. When she came to Hopkins, the medical photographer took this picture as a permanent record. After a series of operations and grafting of skin, this photograph was taken to illustrate one of the intermediate steps in the almost miraculous process of rebuilding a portion of the human body. And here, almost 2 years after the first photo was taken, we see the completion of this process. The job is done. A new chin has been built. The medical photographer, taking one photograph after another, has recorded the progress of a miracle of medical science. The camera records thousands of diseases and bodily afflictions in hospitals all over the country. Here we see the painfully gnarled hands of an arthritic patient, photographed when treatment began. As the treatment progresses, more photos are taken, and the doctor can compare each stage of the progress. The doctor can always look back and see the progress resulting from his treatment. The medical photographer does not always remain in his studio. He often goes into the operating room where he photographs each step of an operation, recording the surgical processes and methods. Among the most delicate of operations is that of surgery of the brain. Here we see a photograph taken from above the operating table in the midst of a brain operation. The surgeon is about to begin his work. As he progresses, the medical photographer will record the step-by-step process of the operation. Even more delicate and exacting is the work of the medical photographer in photomicrography, the photographing of pieces of tissue as thin as 8/25,000ths of an inch thick. Here is Mr. Reether, one of the medical photographers at Hopkins, to show us one example of photomicrography.
This is a photomicrographic camera, which is composed of a microscope, a light source for illumination, and a camera suspended over the microscope. Now, these thin slices of tissue have been cut and stained in the histology laboratory in order that the cell structure may be studied for diagnosis. When these slides are placed on the stage of the microscope, greatly magnified images can be obtained on the ground glass focusing screen of the camera. Here we can see a normal area of the lining of the colon or the large intestine. As we move the slide along, we come immediately next to it an area of destruction which has been caused by amoebiasis or dysentery. Back again, we see some more normal tissue. These pictures made with this instrument are used for publications in black and white and color.
Here is a photograph of an embryo, photographed only 40 days after fertilization. Now that it is possible to secure such photographs, one can follow the growth of the embryo from the time of fertilization until this embryo develops into bone and tissue. This may enable the scientist to learn more about the early stages of development in the birth and life processes. And finally, a photograph of a hand. Not a human hand, but a wax hand, which has been molded, carved, and painted by a medical artist. Lifelike in quality, this model of a hand leads us into another realm of medical art. This wax hand was molded, then carved and painted by a medical artist to be used in a medical exhibition devoted to illustration of the various types of skin disease which can be contracted. This form of medical art is known as moulage, from the French word meaning to mold or to cast. How are these moulage objects made? Let's watch as Mrs. Elizabeth Blumenthal prepares the wax model of the hand. First, the hand is placed in a heavy canvas bag. Into this bag is poured a liquid agar, which completely fills the bag, seeps between the fingers of the hand, and even fills in the tiny crevices of the lines on the skin. The bag is then placed in a container and surrounded by crushed ice. The ice is packed down tight in order to speed the drying process, which takes anywhere from 25 to 45 minutes. When the agar mold is dry, the hand is easily removed, and the first step of the job is completed. The model of the hand is definitely outlined inside the mold. The next step is to fill the mold with wax. This wax remains in the mold for several hours until it is hard. Then the outer agar mold is cut away, and the true reproduction of the hand is ready to have the bruise, cut, or skin lesion painted on it. The model hand is ready to serve its purpose in the development of medicine. The hand is only one of the many anatomical objects made. This large moulage represents a cross-section of the human head, showing the important structures of the nose, and magnified many times. This moulage is used every week at the Johns Hopkins School of Medicine. From it, medical students learn about this portion of the body. Mrs. Blumenthal is highly skilled in the art of moulage. Let's watch her as she demonstrates the steps necessary to create this large model of the nasal portion of the human head. First, she must study the human skull to learn the detailed conformation of the skull. Then she must study the textbooks, which will teach her every detail of the interior of that skull. Next, she must prepare a miniature molded to exact proportions, from which she will fashion the enlarged model. As Mrs. Blumenthal described her work to us, she begins by fixing clay to an armature.
Here's the beginning construction of this clay model. As you can see, we started with a heavy pipe armature, and on that we placed wire screening. Now we build clay upon the wire screening, and when that's completed, we put in the smaller details and the larger structures. When the whole thing is completed, over this we pour a negative molding material, and we remove that, and into that we pour plaster of Paris. Now our plaster of Paris model is this one here, and in this state it's very rough. So from here on we have to polish and sand and chisel in order to get a lovely finished model. This model at present is mostly hollow, but we have reinforced it with burlap and lighter weight material. And then finally we have what would be the finished product. This is the model that was made in Germany, and it is 6.5 times actual size. It represents the nasal region, a midsection through the head, and here is the nose, lips, and the teeth. Now in this model, these projection-like ledges are called turbinates, and they are removable in order to demonstrate
the sinuses. And here we have the sinuses. This model, because of its huge size, is excellent in demonstrating clearly the smallest anatomical detail.
And this, ladies and gentlemen, is part of the story of the medical artist and the medical illustrator. Men and women who are working behind the scenes day after day in the field of medical research and clinical work. It was particularly easy for us to bring you this program this week, particularly if we could tell it with the background of Max Bradel. Max Bradel was the originator of this new profession, and around the world, in Baltimore and in Paris, Max Bradel was affectionately known as Papa Bradel, a very great man. Next time that you hear of a piece of medical research, you know that behind this medical research there is the medical artist who is working with his pen, working with his pencil, perhaps with clay, plaster, as you've seen here tonight in the building of these moulages. Or perhaps the medical illustrator is in the eye clinic, looking through a microscope, peering at the retina and the cornea of the eye, in order that patients may be helped, so the doctors may know the progress of disease from its first stage to its last stage. This is part of the work of the medical illustrator, which we've tried to bring to you this week. Think of them the next time you hear of a great medical discovery. We're glad that you were with us, and we hope you'll be with us next week when the Johns Hopkins Science Review brings you a program about the tools of the trade.
Here are the instruments used by the engineer and the architect. Some of the tools with which homes, skyscrapers, and great industrial plants are designed. Here is the important tool of the bricklayer, the trowel with which the bricklayer lays brick upon brick to build strong homes and mighty factories. Scientists also use specific tools. What tools do the scientists use in their laboratories? Next week, we will wander through a number of scientific laboratories and see many of the tools of the scientific trade. As we watch the scientists using these tools as they carry on their scientific investigations which create benefits for each of us. Be with us next week when we explore tools of the trade. The Johns Hopkins Science Review is produced by Lynn Poole, directed by Paul Kane. Associate producer is Robert Fenwick. Associate director, Ed Sarrell. Art direction by Barry Mansfield. Your narrator was Ted Jaffe.
This is the Dumont Television Network. Now stay tuned for wrestling from Columbia.